BioSTL will pull out all the stops for a thriving innovation economy in the St. Louis region.
For us to build a successful innovation economy, we need to be globally connected. And if you're on the East Coast and the West Coast, you're just naturally globally connected. But here in the Midwest, we have to take a very deliberate effort to that.
That's where Vijay Chauhan steps in. He's the lead for GlobalSTL, the international recruitment arm of the nonprofit BioSTL. BioSTL programs are designed to solve important world challenges. GlobalSTL plays a major role.
Make St. Louis a magnet for top global innovation that is coming to the United States, but doesn't think about St. Louis as a place to go and do their business. The areas we chose were the areas where we have significant strength as a region. Healthcare is one of those areas.
By hosting annual health innovation summits like this one, GlobalSTL is fulfilling its mission.
If you line up all the healthcare organizations that are headquartered in St. Louis, BJC, SSM, Mercy, Centene, Express Scripts, all of these folks, they have combined revenues of about $360 billion. That's more than Boston, Cleveland, Philadelphia, Chicago, Nashville, you name it. But these innovators didn't know any of that. We have more buying power that they want to access. They just didn't know anything about it.
This year, the focus is on workforce innovation to offer solutions for the healthcare workforce crisis.
This is such a big crisis, and they're all desperately looking for solutions.
Held on the campus of Washington University in St. Louis, the summit brings together health systems from across the country.
We have 32 healthcare organizations from 16 states.
To share ideas and learn new ideas from some of the world's top innovators.
Sustainability.
And here, Mercy shares insights about an innovation the healthcare system created to help solve its own nursing shortages system-wide.
We're not just solely focused on those 12-hour shifts. We're breaking them up into 4, 6, 8-hour blocks to support that work-life balance for many of our nurses.
It's an app for Mercy nurses to pick up the shifts that work best for their lives.
It's available to our in-house coworkers, but also to this new role that we've created called the gig worker, so the on-demand worker. And we consider all of those types of coworkers to be Mercy employed.
And tech companies pitch their platforms.
We have over 100,000 W-2 clinicians that use our app looking for their next shift.
And it's saying here are all the 15 nursing opportunities this week across these different health systems, and I can give this for 2 hours, and they tell me what the rate is. And I say, yeah, I think I can do that.
There are apps that even connect services for nurses who need childcare, or in the case of Uber Health, rides.
Uber Health says, we'll give you a free ride, book it right then. All of a sudden, I'm activating this latent workforce that today cannot work full-time, but can work in these narrow slices that works for them, and you add it all up. We call this activating the latent healthcare workforce.
Shifts here and there.
This company's unique solution is getting attention. MedArrive technology gives healthcare a boost by providing access to a network of EMTs and paramedics.
Even before MedArrive, it was very common for EMTs and paramedics to have 2 or 3 jobs at once. Right, they're working in long-term care facilities on weekends, moonlighting at the high school football game on Friday night.
MedArrive gives the skilled healthcare workers a new way to help people.
A subset of patient populations that are hard to find, hard to reach, hard to engage. We're delivering high quality, more convenient care for the patient in their home.
Promoting healthier lives, healthier communities, and takes the burden off hospitals.
Any healthcare organization, they come to us and they use our platform to build out these care programs. And then finally, we are re-engaging this patient back with a primary care provider.
GlobalSTL invites solutions that are likely to have the most success.
And we are only interested in the best innovation. Why do I want that? I want our St. Louis corporations to be the acquirers, not the acquired.